from Belgium and Brussels.
Good morning, everybody. I'm going to talk about acute liver failure and hypoxia hepatitis after cardiac arrest. In the first hour following the return of spontaneous circulation, the reperfusion injury may appear. Ischemia and reperfusion injury may on one side affect the brain and worsen the neurological recovery, but can also have an impact on all other organs such as the liver. In this study, we compared the hypoxia hepatitis incident with the ICU mortality, and in our study, the aim of our study is to evaluate the impact of hypoxia hepatitis and acute liver failure on the outcome of post-cardiac arrest patients. This is a single-center study, retrospective study. We collect all data between January 2007 and December 2050, and we admit all comatose patients admitted after in-hospital and out-of-hospital cardiac arrest to our ICU. We excluded the patient without liver function test, and the patient died before 24 hours from ICU admission. We collect all the demographic data, the characteristic of cardiac arrest, liver function test, the support treatment, the length of stay in ICU, and the neurological outcome. And we defined hypoxic hepatitis like an increase in aminotransferase above 1,000 units per liter, and acute liver failure like a new onset encephalopathy, elevated total bilirubin, and an INR measured than 1.5. And we defined the neurological outcome with the CPC scale. We admitted 435 patients. We excluded 61 patients for early death for missing data, and we included finally 3,074 patients. The 56% of patients have acute liver failure, and the 7% of patients have hypoxia hepatitis, and the mortality in total in the ICU was of 52%, and the poor neurological outcome was 61%. The result, the patient with hypoxia hepatitis developed more frequently shock and an higher baseline lactate and a lower central venous saturation of oxygen, and acute liver failure occur more frequently in patients with hypoxia hepatitis than others. And we find also in the multivariate analysis that epinephrine lactate on admission, also the treatment of support like the CRRT, they are independent predictor of hypoxia hepatitis. The hypoxia hepatitis also occurred more frequently in patients with unfavorable outcome than the patient with favorable outcome. We divided in different groups, and also the ICU mortality and poor neurological outcome according to the occurrence of hypoxia hepatitis or acute liver failure. And non-shockable rhythm, epinephrine, acute kidney injury are the independent, also hypoxia hepatitis are independent predictor of ICU mortality and unfavorable neurological outcome. Conclusion, in this study, hypoxia hepatitis was observed in only 7% of patients. Dose of epinephrine during the CPR, lactate on admission, and the need of CRT were independent predictor of hypoxia hepatitis development, and the occurrence of hypoxia hepatitis and not of acute liver failure was a significant risk factor for a poor neurological outcome. Thank you.
Thank you. Any question from the audience? What is the impact of your findings on the management of patients? There is any effect of these results on the management of patients?
No, because it's a retrospective study and we
Okay.
don't have this.
And you
Maybe
think
he's
that
interested to do
it's epinephrine which is responsible for the hepatitis, or it's shock and the severity of shock?
no, it's the first
you
one.
see-
The severity of injury and also the time from collapse to return of spontaneous circulation is the more important factor for the epilepsy hepatitis.
I did not catch if you exclude the patient with prior liver disease from your database.
We did this.
Yes, you exclude this patient.
Yes.
Okay. That's a nice study. Any questions? No? So,
Thank you.
a lot. And the next speaker is Dr. Park from Seoul. The role of pulmonary artery